are having this condition is either malaria induced or it's cancer induced, or there's a failure of the liver, or you are now having an overactive spleen. So, and sometimes these ones that occur with adults are sometimes caused by adults themselves, like those who are engaged in excessive alcohol and leading to all manner of or drug abuse, leading to the failure of their livers. Let's continue. Let me begin to break it down. I have told you that how jaundice developed. Number one, red blood cell breakdown. Red blood cell breakdown. Our body regularly breaks down all red blood cells. Please take note. When blood cells get old, especially our red blood cells, they are broken down and they are usually replaced with new ones. And during this breakdown process, bilirubin is formed. So that is how you get bilirubin in your body. Another way you get bilirubin again is the processing by the liver. Are you getting it? It processes so that it can be part of the bile. And you need your bile to help digest food. So the liver does that job of bringing in bilirubin as part of the contribution to the bile fluid that is needed for the digestion of food. So you can now see that in the first one, red blood cell breakdown, if there's over breakdown of red cells, then you can begin to see an increase in bilirubin. Now, for the second one, if the liver malfunctions, you now find out that one, the bilirubin will not go to where it ought to go. That is, to be part and parcel of the constituent of your bile. And because it is not going there, it will go somewhere else. It will go somewhere else. So you now find jaundice happening as a result of these two malfunctioning. And so when you now have too much of this bilirubin in your blood, they begin to leak into tissues surrounding your blood vessels. They begin to leak. We now know how they are formed. We now know where they are formed from. So once they are formed like this, they begin to leak into your blood vessels. Now, this leaking of bilirubin is what now makes the skin to be yellowish. And the white part of your eye, we refer to it as the sclera, now becomes yellowish. So you now find when you are looking at somebody with jaundice or icterus, you now find the person having this yellow coloration of the skin and the white part of the eye being jaundice, that is yellowish. Then for we medical personnel, we can determine the level through medical laboratory tests. We can tell how level, whether it's a 1 plus 2 plus or at a very higher rate. Now, what causes jaundice? I've already explained it, but notwithstanding, we use what causes it and the stage it happens to determine even the type, because we have pre-hepatic jaundice, we have hepatic jaundice, as well as post-hepatic jaundice. What is pre-hepatic jaundice? This type of jaundice happens before your body makes bilirubin. So even before the body begins to make bilirubin, once we begin to see too many red blood cell breakdown, we know that stage now. We are now looking at the pre-hepatic jaundice type. Why? Because we're in the patient's body, there's excess breakdown of the red blood cells. There are several tests that can be done in order for us to assess this level of breakdown. Then the second type is the hepatic jaundice. So in this particular one, your liver cannot remove enough bilirubin from the blood. It cannot process it to be part and parcel of the bile constituent. And because it takes a little and some others are left behind, you now find the excess going into blood or body tissues. Now, when this begins to happen to an extent, you now find the patient to an appreciable level developing what we refer to as a liver failure. So, jaundice or icterus is not something we play about. Sometimes there's this myopic
Ìwọ́n lè tẹ̀ sí
pandemic
chat wọn
mentality that
pé wọ́n ti
we
bẹ̀rẹ̀ pé
adults
lábàá
do
ti bẹ̀rẹ̀.
have most times, that it is a disease that, so we have this myopic pandemic mentality that it is a disease condition that can only be seen with children. No, if you go to the hospital, you'll be so shocked. People with liver problem as a result of their own attitude, their own environmental attitudes that have really, they've overlooked advice, they've neglected suggestions from medical experts, and they have exposed themselves to this kind of condition. Then the third one being post-hepatic jaundice. This one is, we refer to it as obstructive jaundice. And this one happens where there's a blockage that stops bilirubin from being drained into the bile duct. Don't forget, I told you earlier that the liver processes bilirubin and it becomes part of the contribution of the bile. Now, there's a process between where it pushes it into the bile. So once there's an obstruction in that particular place as a result of blockage, disease conditions can make that place block. Some of the diseases we've mentioned earlier, your attitude and your lifestyle can make that place block because of overwork. Once that place blocks, then the bilirubin cannot be contributed into the bile duct. And once that happens, once there's an obstruction, we refer to this type as post-hepatic jaundice. Why? Because the bilirubin presence in the skin is as a result of the obstruction. So pre-hepatic jaundice cause I've already explained to you. It's common with children. I've equally explained diseases that can be responsible for the second type, which is the hepatic jaundice. Viral pathogens like hepatitis A, B, C are some of the recent conditions we see among adults, making them to develop jaundice. As for the pre-hepatic hemolytic anemia, if you look at most of these children coming down with very poor blood levels, you see them coming down with this pre-hepatic jaundice type. And for the second one, disease conditions, I told you earlier that there is what we refer to excess intake of alcohol, or what we refer to as alcohol-induced hepatitis. If you remember, in one of my lectures on hepatitis, I spoke elaborately on alcohol-induced hepatitis. So for those who missed that lecture, I want to advise that you go back and go through our lectures on hepatitis A, B, C, and D. We did an elaborate work, and thank God for our country director and all the directors in Superlife. They've made sure we have all of this on our platform. I'm even currently working on a book, and once it is approved by Superlife Nigeria and our global Superlife partner, all of you are going to come firsthand, face to face, with a book that will just not only give you academic knowledge, just like we do every Friday. You'll be having it in your hands to go through, to peruse through, so that you have another doctor in your hands. Thank God for the works of Dr. Chooks and other partners in the health industry that gave us the health manual. So our participants should be prepared. All of you in Superlife and those that are here to join, please kindly join, don't waste time. This is one company that is not going to back down. Just when you think it will drop, forget it, it's climbing higher. We will be coming up with different items that will benefit the world. So for those who are praying for negativity to happen, they will never find it in Superlife. Because we are all Christian and God-fearing minded. Even the Muslims love what we do. And we have a lot of Muslims in our midst joining the winning trade, and God will help us. Now, we talked about autoimmune disorders as part of it. Those, anytime you hear autoimmune in any of my lectures or in any of our lectures, just know one thing. By now, you should be familiar with this term. Autoimmunity means when your cells begin to attack themselves. There are several reasons why this thing can happen, and we have over-emphasized on it. So there are some people that can have autoimmune disorders, and this can lead to either increase in the production of bilirubin. Then for post-hepatic jaundice, we have causes like gallstones, inflammations of the gallbladder, or cancer of the gallbladder. Don't forget the gallbladder is the one that plays that major role in food emulsification, where bile comes in and all of that. So then the pancreas, once there's a tumor of the pancreas, what we refer to as pancreatic tumor. So all of these can play a prominent role. Now, if you look at jaundice, jaundice is a global phenomenon. About 1.1 million babies worldwide develop severe, potentially life-threatening hyperbilirubinemia annually. Now, if you look at this figure, it's not something we should play with. If we are having 1.1 million babies developing icterus on a yearly basis, then it should be something that calls for concern. And the bad news is that if you look at the global map before you, you're going to see clearly the highly dense area. The highly dense area is sub-Saharan Africa. For some of you that are familiar with geography, you can see where Nigeria is. Nigeria is heavily painted red with other West African countries. You'll be so shocked that Benin has a very low rate of hyperbilirubinemia compared to us with all our medical brains and medical expertise. So what is really happening? South Asia too is another section of the world. If you look at America, 0, Europe, 0, a deep south of South America, 0. It's only the central part of, or the northern part of South America, they have very little incidents. So the bulk of the incidence is in Africa, especially West and Central Africa. If you look at South Africa in the map there, it's almost 0. So what is it that South Africa is doing that we cannot do? If you look at North Africa, Morocco, Tunisia, and the rest of those countries, Algeria, it's almost 0. So what is wrong with us? So that is why this lecture is coming in at this time. Different researches that have been done in Nigeria have shown that the prevalence is between 10 to 15%. So it goes to tell you that Nigeria's situation is not good at all. It's not good at all. If you look at even the levels of bilirubin in my bar chart, you can see clearly that the age of people that are even coming down with the recent research that was done is you now find people of 15 to 20 years, which is highly surprising. Highly surprising if our young teenage children will not be going through this. Initially, it was more with the neonates and the young little babies. But that, because of government intervention, we are beginning to see a drop in icterus attack, but rather it has not left our country. So the bar chart before you clearly shows you the situation we are currently in. Now, when you have jaundice, how do you feel? First and foremost, there's going to be fever. Your skin, of course, has tinted yellowish, your eyes yellowish. There's pain in your belly. You have these flu-like symptoms. When you go to pee, the color is so dark. It's so dark colored. Even when you go to poo, your poo-poo is colored. It's colored. Your skin is colored. Your eye is colored. Your wee-wee is colored. Your poo is colored. You find the patient looking tired and confused. In some cases, we see some of these patients having itchy skin. And don't forget, their blood levels goes down, while in some, again, they have weight loss. They experience weight loss. So you can see in a nutshell, I've been able to take all of you through our topic for today in an academic but yet interesting and simple to understand manner. So I want to appreciate you for taking your time and your pain to listen to me. Just like we do it every week, not all of us have autonomy of knowledge. And that is why we share our lectures. So at this point, permit me to invite my friend, my brother and colleague, Pam Chilaka, who will be taking us
Prof,
through the treatment, and later
sir,
we'll be bringing in
Farmer is not is not in the room. You can continue.
How
Farmer
our
is
super
not
life.
in the room.
Okay.
Farmer is not in the room.
That Pam Chilaka is not around.
Yes.
What about Dr. Chooks?
No, it's not.
Now, the first signs you see are the signs we have already enumerated in the course of our lectures. Once these signs are seen, please, I will want to advise that the patient goes for a test immediately. Visit any recognized medical diagnostic center for a test. One thing is that there's no way your blood sample will be collected if it is handled by a trained medical lab scientist. Such a person should be able to identify. Already the medical doctor who is even referring the patient to a diagnostic center is already aware, because the prognosis before him or her are clearly visible. They are clearly visible, because one thing with hyperbilirubinemia is that it is not hidden. It is so clear. Even a layman can see what is going on, though they might not know the term to call it. So once this patient is taken to the hospital, a test will be done. Other tests will have to be done. Don't forget, we are talking about the 3 stages. So the issue of the liver too will have to be checked. The issue of the obstruction around the area of the gallbladder has to be checked. So a scan can be done on this region. Medical personnel can carry out an ultrasound examination, or what they use imaging, that what we refer to as imaging, or carry out a CT scan and do a liver biopsy, where a little tissue of the liver is taken and observed. So once this is done, you'll find out that it becomes easy for the doctor to determine whether the patient is having icterus or not. And it equally helps the patient and the medical personnel to determine the level of the presence of the bilirubin if the patient is at serious risk. Why? Because it is a very fatal condition. It is a very fatal condition. Just like I've said earlier, some patients experience other conditions like itchy, the itchy skin. So once all these are seen, it now helps the doctor to have an informed diagnosis for the patient's situation. Now, the issue of treatment medically has to do with the condition, because you don't treat bilirubin in isolation. You don't begin to say you want to take it to being normal without treating the cause. So in handling bilirubinemia, what causes it will not be the first point of action that the doctor will want to handle. If it is a failing liver, that will be handled. If it is malaria, that will be handled. If it is as a result of sickle cell anemia, that too will be handled. So once you are able to handle the cause of the problem, you are on your way in dealing ruthlessly with hyperbilirubinemia. So it will be nice for us who are listening today to see how you prevent yourself from getting it in the first place. And one thing I will emphasize in my today's class is that if you're on alcohol and you know you cannot do without it, try and reduce the quantity you take, please. And if your cholesterol level is on the high side, I would suggest you go for a cholesterol check so that you see how you reduce it. Then for the infants, please, let's advise those that are around us to always ensure that our little babies are taken for vaccination, and they are exposed to wonderful hygiene. The environment, the hygienic environment should be good for them, not just for them, for the adults alike. So once all of these procedures are imbibed with, you find out that we can just find ourselves living healthy. Now, for those who are exposed to constant malaria, please just ensure that your body is top-notch when it comes to your immunity, so that your body can fight, or you have other materials like a Super Life product that can help safeguard you from this unnecessary embarrassment. At this point, please permit me to invite our wonderful coach, a good friend, and a mentor in Super Life. Coach Sampson, please, are you around? You have the floor. Hello, Coach Sampson.
Wow. Yeah, good evening. Thank you so much,
Hello,
Dr.
Coach.
Root, for that. Yeah, thank you so much, Dr. Root, for that powerful presentation. Thank you so much for what you have been doing for us in Super Life. We're so grateful to have you. We are blessed to have you in our midst. You have been a wonderful addition to us. This last year, we've been having this has been a very powerful time to listen to you all the time. And thank you in advance for the material that you want to make available for us to learn more and know more, particularly when it comes to health, because health is really the wealth. I'm telling you, a lot are happening. Sorry to digress. Today, somebody called me today. We were talking, and he told me that one of his, he has a brother that, had, serious health challenges. The person has been suffering from probably high blood pressure, and maybe not properly managed, and the person collapsed, and now presently at the OUTC in April. He told me that just within 3-4 days now, he spent close to 1 million naira. That's why when you're telling people, that's why I was telling people, when I'm telling people and we talk about our products that is solving real life medical challenges, and people are saying it's expensive, I just look at them and I said, that is ignorance of what is really happening. And then just to stabilize the person, let me say it's not probably in coma or have, it's not really, now they want to move into ICU. And the person is telling me that it will cost them 300,000 naira daily. if it's moved to ICU, it will cost them 300,000 naira every day. Because he has a stroke now. And I think they said there's a blood, something in the brain. I know it's a ischemic stroke. It has to do with brain. So there's a lot of blood in his brain and so many other things. And he has to be on oxygen. Now moving into ICU now, it will cost them average of 300,000 every day. That is serious. So that's why for every one of us that is on this Zoom call, that you listen to Dr. Ruth every week and listen to our other medical personnel, like in person of Chilaka and our able doctor of Super Life, Dr. Chooks as well, and listen to me as well as some other people talking about different kind of health challenges, how we can prevent it particularly. The essence of all this, our meeting every Friday, is not only for those that are already suffering from these medical issues or medical conditions, but particularly for those of us that are not yet in that category, so that we can learn and we can know how to prevent ourselves. And for those that are already suffering from the problem, they can know how they can get themselves out of that challenges, and so that they can live their normal life, healthy life, and enjoy the life. Because any life without a good health, I'm telling you, is not life at all. I'm telling you, you don't appreciate what you are enjoying until when you find yourself in that condition. Like the person I'm talking about today, all the family member now, they are in a serious mess now. Financially, they are, affected. Psychologically, they are affected. Even time. Some of them, that person is telling me that she couldn't even go to her own business because of these challenges now. They have to look up one person, also for financial aspect and the psychological effect as well. That's why we need to take all our meetings very serious by applying all the knowledge we are gathering every week to the betterment of our life and our family members. It's very, very important. So today we're talking about jaundice. It's a age-long sickness, age-long challenges, that's been, in existence for a very long time. It happens to mostly children and also adults, particularly people that are having sickle cell anemia patients and other, people in some medical challenges. They also suffering. Let me say this. Even myself, I'm talking to you, my little son, my second born, had it when we gave birth to him. We were told that he has jaundice and he also have low sugar. Yeah. And I remembered at the hospital when he was, and I think they done a lot of things, and they refer us to Lut. Even so, my wife were discharged not to go home, but to be referred to Lut. But I remember I told them, the doctors, I said, well, thank you for all your care for what you have done. You're already in Superlife. It was a baby of Superlife because I had him when I joined Superlife. So what am I trying to say? So eventually I told them, I said, don't worry, you have tried, you have done your best. Leave the rest. I know what to do. And I remember from that point, I started using Superlife products for him. Started using Superlife products for him. And today, his voice, what a beautiful boy, very active, doing wonderfully well. Never gone to any other place apart from once he was discharged from the hospital. That day, it was even the day of the naming ceremony that my wife was discharged from the hospital. From there, she moved to the house and we had the naming ceremony and the party even that day. And since then, that was why I use the local method, things that we know, and from then started using a start. That's why that boy started taking a start as more as like around 3 months, around 2 to 3 months, started taking a start. So, and that was the end of the story. So we have a powerful product that is really solving real life issues, really solving real life issues, real life challenges. So that's why we're not playing here. And we have a gold, a diamond in our hands. Superlife S30 particularly is a life in a satchel. We call it life in a satchel. So when you have it, I'm telling you, you are rest assured by the grace of God that there is no cause for alarm. Whatever any health challenges you might be experiencing or you might be thinking of, you know you are in a safe hand. And also the good aspect of it is that it is good for prevention. And they always say that prevention is better than cure. That is the main aspect I want us to focus on mainly. Many a times, some of us we are always reactive, but it's better to be proactive. And the only best way can be proactive is to prevent the occurrences of those problems. So, like doctor have advised some of us that are, engaging in a lifestyle that will lead us to all these challenges, we should try to desist from it. And also, we can also empower our system, our body, to always protect us from all these various health challenges that might be, threatening us, or that might want to, put us in this kind of scenario. So Super Life SC30, like is a stem cell based product. It's a stem cell based because it's a stem cell based product. It's also very preventive. We call it is a preventive medicine. It's a preventive medicine. So the main focus, like I said, should be for prevention. So you don't need to be sick before you take SC30 particularly. You don't need to fall sick before you take SC30. You don't need to fall sick also before you take SIC. Those two products that were meant to treat this disease is something you can take for prevention, because SC30 being a stem cell product has ability to repair damaged cells, to rejuvenate your cells, regenerate your cells, renew your cells daily, so that you will be in constant healthy status. You be in constant healthy status. Like I used to tell people, I said, according to the WHO, 80% of people living in the world, they are in sub-healthy nature. Sub-healthy nature. That is, they are not truly healthy and they are not totally sick. They are in between. That's why you see that a lot of things happen to people, and when you hear people saying it's so sudden. Like the story I was telling you tonight, the person was, he was doing good, just say he want to he stole out after eating, just to exercise, and that's how he collapsed, and he has to be rushed to the hospital and become what we are talking about. So because most times a lot of people are on healthy nature, sub-healthy nature, they are not truly healthy. So that's why something can trigger anything within the system, and they become the victim of a intensive care unit. So that's why we need to guard against such occurrences by constantly updating, optimizing, let me use this word, optimizing our health. That's one of the key advantages of stem cell product, is mainly for optimal health. Optimal health, not maintenance, optimal. There's a difference between maintenance, there's a difference between optimal. Optimal health means that you are not actually sick, but you want to take your health status to a higher level, the optimal level, where you will be at rest. You will be confident that there won't be any cause for alarm. There won't be any incidental, challenges of, rushing to the hospital, or, being collapsed or what have you, because your status, your health status is at optimal level. Upgrading it every day, raising the bar, increasing the circulating stem cell. The circulating stem cell, you are increasing circulating stem cell, you are repairing the damaged one, you are activating dormant cells, and rejuvenating and regenerating the dead cells. Particularly as we grow older, our cells become degenerated, aging. As we age, our cells deteriorate with age. So we need constantly to rejuvenate and revitalize our cells and tissues. And the best way to do that is by taking a product like SC30, which has the ability to repair damaged cells, activate dormant ones, rejuvenate the vitalized one, and regenerate the new cells in the body. And the body become brand new daily and daily, every time. So that is the best way to go. So, like I said, SE30 has every ingredient that you need that will make your cells to be daily renewed, and you can be in constant good, you can be constant in a good health. You can be in constant good health every time. Taking our powerful product S30. Look at it. It's like, look at it. That's why I said the main focus should be on prevention. That's why we said super light S30, particularly the new S30, is anti-UV, anti-radical, antioxidants, and anti-inflammation. The word anti means, it's like a prevention. You can anti it. You can combat it. You can fight it before those things, become, inflammation. Inflammation is the stage of formation of diseases. When disease has been formed, that's when the inflammation has taken place. So you can anti all these processes so that you will not lead to that, level. So that is where, and because S30 being a stem cell can unlock the unlimited potentials of your cells. It can unlock the unlimited potentials of your cells, meaning that your cells has unlimited potentials. What are the unlimited potentials your cells have? Is to repair damaged cells, is to rejuvenate the cells, is to regenerate the new cells in the body and make you a brand new person. So you can be old, you can be 50, you can be 70, and carry the cells of a young person, like ego. Bible say, that's why Bible says that we will renew our strength like eagle. Because what eagle does is that eagle rejuvenates. After 40 years, eagle will go to a higher mountain and shed off all the old, and renew his strength. So you can become like an eagle through using our SE30 to rejuvenate all our cells. That is the concept of stem cell. And there is no limitation when it comes to stem cell. There's no limitation. No limitation. It's not particular for a particular, ailment or diseases. Irrespective of any kind of challenges, Super Life SE30, being a stem cell, can help you either to prevent or to even cure or take care of those challenges, to treat them. So irrespective of the challenges you're having, our product can help you. So when I was speaking to that person, I told you the story about, I asked if the person is not in coma, that if he's not, that he can use, our product can be of a good help. But she said she will get back to me to know, because once the person is moved to ICU, it won't be, the doctor might not allow the product to be administered to him. So Super Life S30 is a very, very powerful product. Like I said, being a stem cell, it is taking sublingual. So it gives excellent delivery system, high absorption rate into your body, and excellent for emergencies. Like I told you, in case of an emergency, I didn't mean that person that collapsed. If somebody, a Super Life member, is around that place, or I was told immediately, you can give the person our SE30, and it will have been a very great advantage for that person. So that's how powerful this product. This is how to take it sublingual under the tongue, and this is the game changer. This is a breakthrough in medical science, a real breakthrough. because this sublingual administration gives it, allowed bypassing all the normal biological processes and go directly into the bloodstream, and from there into the bone marrow, where cells and tissue emanated from, and moving to even other circulating stem cells. And this can have a very, a good effect on the system to really bring the system back to normal functions. So, and it will give you that smile again, irrespective of any challenges you are facing or any kind of disease. Superlife AC therapy has the ability to revive you, to bring you back to normal functions, and give you that smile and joy back again. You can restore you back to normal functions. And the reason is because of all the powerful ingredients that were put together to formulate this product. We have the Zula vitis, which is a great stem cell, which high level of antioxidant properties and so many other, ingredients that could help the body. You have the Balu domestica, which is the miracle apple, the apple that has a healing power. No wonder when people take our product, their healing kickstart immediately, because the apple is a miracle apple. It has healing power. It has self-renew. That is why it can renew all your cells, irrespective of how damaged or how weak or dormant they are. Superlife that can do that because of all these ingredients. We have the glycidine cantaloupe, glycidine gliadin, we have black currant extract, we have beetroot extract, we have the golden kiwis extract, we have the prickly pear cactus, and we have the sick buckthorn. There are different powerful ingredients that were put together to formulate this powerful product called SC30 that is really getting results and changing life worldwide. Getting results and changing life worldwide. And lastly, I will move to the second product recommended for treatment of this challenge, which is the SIC. As powerful as SC30 is, so it's the SIC. Why? Because SIC, though it's a supplementation, but because of the way it is being formulated and because of the ingredients that were put together to formulate SIC, it becomes a very powerful and vital ingredient. Let me show you something. This is SIC. Sorry. I'm trying to, don't mind me. I'm trying to fast track. Yeah, this is SIC. Look at SIC. I want you to do something very peculiar about SIC. What makes it very powerful? SIC is a powerful blend of alpha news. That is alpha. So let me leave the great grammar. Alpha and concise Q10. The formula helps support the natural release of adult stem cell. Natural release of adult stem cell. This is a very key factor. I always tell people, anytime you are telling people about this SIC, you must really emphasize this. Because some people will look at it just as supplementation. People will look at it just a mere supplementation. Why it is higher than mere supplementation? Because it has ability to support the release of adult stem cell from where? From bone marrow, and also increase the circulating stem cell in the body. This is a game changer, because any product that can increase or support the release of adult stem cell means your stem cell. Adult stem cell is referring to your stem cell. As an adult, your stem cell is called adult stem cell because you are an adult. So any product that can help the release of your stem cell from the bone marrow and also increase the numbers of circulating stem cells in your body can do anything. And because of that, that's why SIC is so powerful. So powerful. That's why it is very important in the treatment of so many, chronic health challenges, exercise is very, very important. Another thing is because it also helps in the boosting of immune system, because our immunity is the soldier of our body. So many things, our body protects us for so many challenges because our immunity is active. Once your immunity is compromised, then you are prone to any kind of medical challenges or any diseases. I used to tell people, I said, if you are AA and you always fall sick of typhoid and malaria, check your immune system. That means your immune system is already compromised. Because once your immune system is compromised, you are prone to any kind of medical challenge, particularly any bacterial infections or virus infection or parasite infections. You are prone to them once your immunity is breakdown. So that's why exercise is so important, because it helps support the release of adult stem cells from the bone marrow, number one. It also helps in increasing the number of circulating stem cells in the body. And then also, it boosts your immune system. And anything that can boost your immune system to the highest level, I'm telling you, it has a lot of effect in your body. So exercise also boosts your immune system. But this one is the special product for immune boosters, and also, blood. So if you are suffering from low blood, low PVC, and what have you, SIC and SSRT is a game changer because of the ingredients that were put together to formulate. When you look at it, we have over 7 ingredients inside SIC. We have the mixed berry. Mixed berry consists of all kinds of berries: raspberry, blueberry, blackberry, and every berry. That is what we put together as a mixed berry. Then we have the alpha itself. Then we have the chlorophyll. We have the moringa. We have the concentrated. We have the guarana extract, and we have the vitamin B complex. When you look at all these 7 ingredients, every one of them on their own can solve so many, can help in resolving so many medical or health challenges. Moringa alone is useful for so many, over 20, 30 kind of, things that moringa can solve. Then look at vitamin B complex as well. It contains about 6, 7 vitamins together, in one ingredient. And when you put all these together, 7 ingredients together as a one product, what do you expect? You don't expect anything less. That is why we are so proud and we are so confident of our Super Life product, because of all these ingredients that have been put together. No wonder, Dr. Chus, you usually say that, it is a divine inspiration for Super Life to be able to put all these powerful ingredients together and put it in one single formulation. He said it can only take a divine directive. It can only take a divine instruction. It's not ordinary. So no wonder the product is doing so wonderfully. No wonder the product is doing, performing wonders in the life of people that are using it for prevention, not so people that are using it for curative or to treat or to manage their medical challenges. So, in conclusion,